April is National Sexual Transmission Infection Month. This is an opportunity for individuals, doctors, and the community to address ways to prevent some of the nearly 20 million sexually transmitted diseases that occur in the United States each year. With us today from the Florida Department of Health in Polk County is Dr. Danielle Chiraboga. How are you doing today, Danielle?
Hi, I'm doing great, thank you.
Excellent. Well, tell us a little bit more about National Sexually Transmitted Infectious Awareness Month.
So this is an important opportunity for us to address these infections that can affect everyone.
Excellent. Now, what age groups are most affected by STIs?
Here in Polk County, the most affected groups are those who are between the ages of 14 and 24. So our very young people are those who are most affected.
Oh, that's interesting. I never would have assumed that.
Correct.
Now, are STIs really a big problem here in Polk County?
They definitely are. We have had an increase in most STIs over the past 8 years. Among them, chlamydia has gone up significantly, and we have a problem with syphilis. And this is a special one that does not affect the same age group that you would expect, the younger kids. There are younger kids affected, especially between the ages of 20 and 24, but there's another surge in people in their 40s to 50s. So it's important to think of this, and it specifically does affect people who are men who have sex with men.
Okay. Now, why in that 14 to 24, was it 14? Yeah, 14 to 24 age group, why is our STDs and STIs so prevalent?
I think the problem is people, young kids feel that they're not vulnerable, and they do not look for ways to protect themselves. So they may not use condoms, or they may think that the forms of sex that they're having, being the oral or anal sex, are not ways to acquire sexually transmitted infections. So they may think that they're being safe and having safe sex when they're really not.
So really, any sort of sex is sex.
Yes, and you have to remember that this includes what we consider usual sex, but also includes oral sex, anal sex, and even at times some infections such as the viral infections, herpes, and human papillomavirus can be transmitted even if there's no penetration, so just by skin-to-skin contact.
So how do these STIs impact the local healthcare economy?
Sexually transmitted diseases are expensive. There's a cost of $16 billion a year for sexually transmitted infections to the healthcare system.
Wow, that's amazing.
It's a lot of money.
And what services does the health department provide to prevent the spread of these sexually transmitted diseases?
The health department is dedicated to prevention and treatment of sexually transmitted diseases. We offer preventive strategies such as vaccination for those that can be prevented through vaccination, and education. We also provide testing both at the field and in the health department, and treatment of those people who are infected. Now, talking a little bit more about prevention, I think that is the most important aspect of what we can do. We don't want to wait till people have acquired an STD to act about it. So what can you do to protect yourself? You can try to always use condoms when having sex, but remember that it's more important to think of abstinence and to think of limiting your sexual partners, especially when people go out to drink or use other substances, because then you're not making a safe judgment about who you should be having sex with. And you usually also, when you're drunk, you don't think of using a condom.
This is sad but very true.
Yes.
And I know that the health department recently received a grant to help with a lot of the efforts that you're doing. Can you tell us a little bit about that?
Yes, we have an interesting grant going on, and it's a nice little project there. What we're going to do is when you come in and get tested for an STI, you can sign consent for us to send you your result by a text message. So instead of having to wait to get your result, and that may be a long wait, you will get it as soon as we have it through a text message. It'll reduce waiting, and it also provides an easier way for you to get your result.
Now, I've always believed that education is the best way to combat any problem in our society. What do people have to think about to stay STI and STD free?
Well, again, remember the most important part is preventing the exposures. So again, abstinence if possible, reducing sexual partners, and using condoms correctly and constantly. But also, there's certain sexually transmitted diseases that we can prevent in other ways. And these are infections that we don't necessarily think of as sexually transmitted diseases. We usually think of gonorrhea, syphilis, chlamydia. But there's other infections, such as human papillomavirus and hepatitis B. Those can be transmitted sexually. And human papillomavirus specifically causes a large problem in healthcare later on because it increases the risk of cervical cancer. It's actually the cause of cervical cancer. So by eliminating this infection, you can eliminate cervical cancer in general in women. It not only causes cervical cancer, it also causes anal cancer in men who have sex with men and can cause throat cancer in people who are having oral sex. So the good thing is we can vaccinate for it. And the recommendation is to vaccinate children when they're around 11, 12 years old, because then you don't have to ask the question of have you initiated sexual activity. And we try to get it in before children have started having sex. It's recommended for boys and girls, but if either your child or you are older than 11 or 12, but still younger than 26, you can still receive this vaccine. And it is actually available at the health department. If you're younger than 19, you can get it through Vaccines for Children for free. And if you're older than 19, you can get it at a cost.
When should someone go in for testing for an STD or an STI?
Well, you have to obviously go in and get tested if you have symptoms or if you've been a contact to someone who has symptoms. But sometimes we think that we have no risk factors for STDs and STIs when we do. Or should I say, we might perceive that we don't. So it's important that people get tested regardless of what their perceived risk factors are. Specifically for HIV, the recommendation is that anyone older than 14 get tested annually, whether they have risk factors or not. Again, that takes away the idea that I may not consider myself to have risk factors, but I don't know what other people around me are doing or have done in the past. You should ask your healthcare provider about testing and make sure that you get tested if your healthcare provider considers it to be appropriate. But as I said, for HIV at least, the recommendation is that you get tested every year regardless of your risk factors.
Dr. Chiriboga, this is some fantastic information. Thank you so much for coming out and sharing it with the public.
I'm happy to do it.
With over 20 million sexually transmitted diseases happening in the United States each year, education and prevention are of great concern and importance to our community. If you are interested in finding out more information about National Sexually Transmitted Infection Month, contact the Florida Department of Health in Polk County at www.mypolkhealth.org, or you can call their phone number at 863-519-7900.